And brothers.
Oh, that's right. Yes, sorry. Sorry, equal opportunity here.
Yeah, big time.
All right. Okay, some of us heard this already in the morning. You're going to be attached to your partner, like we said. Make sure if you have any questions, you ask our girls. They're going to be wearing a headset. If you need anything or you know your doctor, like Dr. Fontana's here, she'll make sure that he has any preference he likes, anesthetic or anything. We talked this morning, key is to, if you are working a room, make sure you let your partner from Park Family Cosmetic Dentistry know that your room is clean and turned over. Because she's going to radio me, we're going to be in the front screening the patients, and at that time we'll know that we're ready to get a patient into your room number. I'm so excited. Okay, and everything is going to be there in sterilization for the people working on this side, 1 through 4. You will, before you even wipe down your room, get your instruments and put them in the sterilization area, and here you could show them where you want them to put it.
Wait, just have to show them about
Dr. Fan is here, okay?
Dr. Fan!
Come on
Yay! Yes.
Welcome.
Thank you. So communication is the key. We are going to screen the patients. Once they get back there, the doctor will make the ultimate decision whether they're going to do what they're going to do or not, what the patient needs, and that'll be a green light to go ahead and get your instruments and do whatever you need to do. So keep on with the communication. If you're running low on supplies, let Hugh know.
He's the man.
Okay? He's the man. He's Handsome Hugh, by the way. That's his name.
Clinical partners from Park Family, if you could take the volunteers and run through how to use Dexis with them and how we're using the numbers for Dexis before we get going. Is everyone familiar with Dexis?
So Tammy, everybody will show you with Dexis, which we all have them under a different template. You're not going to need to use Dentrix at all. They just have a number. Everybody will be given a number, every patient, and they'll have a certain number allocated to them as well in Dexis. And we have to, everybody that's resident in extraction, as soon as that patient gets in your chair, make sure you take that x-ray so your doctor can check them and go from there.
Can you talk about how to dismiss the patient when we're done?
Yes, once you're done, you're going to walk them to the front here, and they will have also in your extraction rooms, if you have extraction, we have a little care package with gauze and post-op instructions, and you will walk them up to here, to this counter area.
It's going to be a registration form, and that's where the clinical notes are also going to be put. There's a section for the clinical notes of what procedure you did, what you used, all that good stuff. So just make sure to go ahead and do the notes, make sure you have your doctor sign it. Bring that registration form up with the patient. We're going to have a collection area for it at the front here when you're ready to dismiss the patient.
And once the patients come in also, they're going to fill out the forms. It has a question on there whether they're allergic to anything or need pre-med. Once they get to us to screening, we're going to ask them again, make sure, and you guys will screen them as well, asking those same questions. Make sure they're not allergic to any anesthetic. Just to ask again, sometimes they don't disclose it, or make sure, you know, they're not allergic to amoxicillin, etc., or need a pre-med.
If they need a prescription, we already have prescription pre-made. All we need to do is fill out the patient's names, birthday, and the doctor's signatures. Okay?
Yes.
Also, when they are dismissed, there's going to be a pre-packed goodie bags for them. First come, first serve. I think we have about 100 or so.
Yes.
Yes.
And we can make up more if we hopefully need to.
Right. So the most important thing is infection controls. You would want to keep in mind that we don't make shortcut. You know, if we need to wait for an instrument, we wait for an instrument. Make sure they've gone through the process. So it's very, very important. Especially if we have so many volunteers here. I'm so excited.
And if you need help, just please ask.
Okay. Anybody has any questions? No? Okay. Well, why don't we partner up and go to the room and get a quick orientations for clinical, and we will be rocking and rolling.
Perfect.